Picture this, you're young, vibrant, and full of energy, but there's a hitch in your step, a nagging pain in your knee that just won't go away. Welcome to the world of knee problems in young adults. You might be surprised to learn that it's not just the older generation that grapples with creaky knees. Oh no, young adults are quite familiar with knee problems too. These issues could range from sports injuries to overuse, and even some genetic predispositions. In this video, we'll be exploring the most common knee problems that young adults face, the mental health struggles that often come hand in hand with chronic pain, and of course, we'll suggest some strategies for overcoming these challenges. You're not alone in this, and there are ways to manage and even alleviate these problems. So buckle up and let's dive into the world of knees and how to keep them healthy and strong. Now, you might be thinking, what knee problems could I possibly have? I'm young. Well, you'd be surprised. Firstly, let's dive into patellofemoral pain syndrome, commonly known as runner's knee. It's a bit of a mouthful, right? This condition is often a result of the stress placed on your knee joint, particularly when you're active or when you're going down the stairs. You'll likely feel a dull, aching pain around your kneecap. So if you're an avid runner or a stairmaster, you might want to ease up a bit. Next, we have ligament injuries. These are the ones that make you wince just hearing about them. The most common ligament injuries in young adults are to the ACL. That's the anterior cruciate ligament for those who prefer the jargon. This is often caused by sudden stops or changes in direction. Think basketball or soccer. You'll know it when you feel it, trust me. Now, onto meniscal tears. The meniscus is a piece of cartilage that acts like a cushion between your thigh bone and shin bone. A tear can happen when you forcefully twist or rotate your knee, often while bearing weight on it. You may feel a pop, and your knee might swell or feel stiff. Lastly, we have jumper's knee, officially known as patellar tendinitis. This is an injury to the tendon that connects your kneecap to your shin bone. It's common in sports that involve a lot of jumping, hence the name. Symptoms include pain at the base of your kneecap, especially when jumping, kneeling, or climbing stairs. So why are these conditions common in young adults? Well, it boils down to lifestyle and activity levels. Young adults are often involved in high-impact sports and physical activities, which can increase the risk of knee injuries. Now that we've covered the common knee problems, let's talk about the impact it has on your mental health. Physical pain is one thing, but the mental toll of dealing with chronic knee issues, that's a whole different ballgame. Imagine a life where every step you take is a reminder of the pain you're dealing with, a constant nagging that not only affects your physical mobility, but also starts to take a toll on your mental health. That's the reality for many young adults dealing with chronic knee problems. It's not just about the physical pain. It's about the constant reminder of your limitations, the frustration of not being able to do the things you love, and the uncertainty of not knowing when or if the pain will ever go away. This constant battle can lead to feelings of stress, anxiety, and even depression. It's like being caught in a vicious cycle. The more pain you're in, the more stressed you become. And the more stressed you become, the worse the pain seems. It's a relentless situation that can feel impossible to escape from. It's important to understand that mental health is not an afterthought in this struggle. It's a critical part of the overall well-being. When you're dealing with chronic pain, it's easy to focus solely on the physical aspect. But the reality is, the mental struggle is just as real, just as valid, and just as important to address. Mental health struggles can lead to a sense of isolation, a feeling that you're alone in your pain. But the truth is, you're not alone. Millions of people around the world are dealing with similar struggles every day. There's a whole community out there ready to offer support, understanding, and help. It's also worth noting that living with chronic pain can sometimes make us lose sight of the positive aspects of our lives. It's easy to get caught up in the pain and forget about the good things. But it's crucial to remember that there's more to life than the pain. There are still things to be grateful for, still moments of joy to be found, and still victories, no matter how small, to be celebrated. But it's not all doom and gloom. There are ways to overcome these challenges. Living with knee problems doesn't mean living a life of constant pain and worry. There are ways to manage these issues and still live a fulfilling life. Imagine a world where the creaky knee doesn't overshadow every step, where the pain becomes a passing whisper rather than a deafening shout. This world is attainable, not through magic potions or secret rituals, but through simple, everyday practices that can transform the way you experience and respond to your knee problems. Take a deep breath. Not just a regular one, but a deep, calming, soul-soothing breath. This is the power of mindfulness, of being in the moment rather than in the pain. Deep breathing, meditation, yoga, tai chi, these aren't merely exercises, but gateways to tranquility and stress relief. But don't stop there. The world is full of people who care about you. Don't shy away from your social connections. Let them in. Let them be your emotional support system. Share a laugh, share a tear, share the journey. Remember the power of small victories. Rome wasn't built in a day, nor is the challenge of chronic knee problems overcome in one. Break down your larger goals into bite-sized, achievable steps. Celebrate every single win, no matter how small. Let's not forget to count our blessings. Gratitude is a powerful tool that can shift our focus from what's wrong to what's right. And if the burden feels too heavy, don't hesitate to reach out for professional help. Therapy isn't a sign of weakness, but a step towards strength. And remember, always consult with a doctor or qualified healthcare provider. We've covered a lot today, but the journey doesn't end here. From understanding common knee problems to recognizing the mental toll they can take, and finally, exploring strategies to cope with the challenges, we've navigated through it all. Remember, always consult with a doctor or qualified healthcare provider for your individual needs. If you know someone who might find this information useful, don't hesitate to share it. If you found this video helpful, don't forget to hit that like button. Subscribe for more awesome content and ring the bell to stay updated. Until next time, keep those knees happy and healthy.